nurses in Nigeria, they have no business touching a
Oh, that's
medication, let
that's
alone injecting or
yep.
giving an IV to a human being because you are not licensed in that department. So
Yeah.
for like someone like me now that I'm a student in as a nurse practitioner, we can actually also, when I finish and I pass my exams, I'm like
Take
a step
orders.
higher now. You can actually kind of like see patients, because my own level now is in psychiatry. I can actually see patients, prescribe medications, but at the same time I still have to be at the confines of
Supervise.
a doctor that has
Yeah.
an NIP. But but like in some states, nurse practitioners can practice without a doctor's NIP in some specific states, right? So, that nurse had no business, absolutely no business holding an injection, let alone injecting a human being. In America here, you can actually go to jail for
For
doing that.
a
That is
long time.
so not wrong. That is so wrong. And it's so unfortunate that in Nigeria the healthcare system hasn't evolved to the level where you can monitor these people. A lot of private clinics have these nurses because they feel like they don't want to pay registered nurses the amount of money that they deserve. You will never see a teaching hospital or a very well-known hospital in Ikoyi or Lekki having these quack nurses. I'm sorry, but like they are quacks. I'm so sorry. They are knowledgeable, yes, because they are always around nurses. They're experienced, yes, but are you certified to give that medications? They are not. I'm sorry about the other lady. I really wanted to come here and just say my 2 cents because I feel like she was even kind of like a little getting it all wrong. And I was driving. I was like, oh my God, no, this is not
Yeah,
it. We need to get the
sister,
information out.
to what she
So
was
yeah,
saying,
that's what I wanted to
I
say.
think
All right,
I
we
think
have
she
a
said
doctor here.
I, I think she said what she said because she wasn't sure of the terminology differences, like you were saying. The CNAs advanced. We also have two stages of the CNAs. There are advanced, and there are also those one that can also, handle colostomy, all those type of stuff. But back home they label them
No,
differently. It's just too wrong. People
no,
are
no,
doing
no,
too
no.
wrong.
CNS don't
But we'll
handle
get the
colostomy. They can see CNS don't handle colostomy. The CNS can actually take the waste and measure it, but it's the LPNs that do handle the colostomy. The
in
LPNs and the RNs are
hospitals
the ones
now.
that do the
No, in
dressings
in
of the
some hospitals,
colostomy.
CNS do.
But to
In some
empty the
hospitals,
colostomy bag,
CNS do.
you do need the CNA to do that. But to do the dressing of the colostomy itself, or to measure
Mm.
or like put a new bag and stuff, it's the LPN, the licensed practical nurses. Or if you don't have that, then it will be the RN, or the RN can do it with the CNA. But the CNA has no business doing a lot of invasive procedures.
People do wrong
So
stuff.
it's very unfortunate that this whole thing happened with regards to the nursing or the healthcare aspect. I think this whole thing should be a learning experience, especially in the healthcare world, to be able to reform and rechange and change the healthcare system in that with them in the Department of Nursing, because I feel like this stuff would never have happened if, with regards to the healthcare department, if the necessary channels were being taken. If he had gone to the hospital, if he had even asked for a private duty nurse who is a registered nurse, that nurse will know that they had to, like, you cannot mix that medication with an IV and a paracetamol in the same IV
Mm-mm.
line. It's either you give it separately, or, to be honest, IM. You give
You
IM
get
one hand. You cannot mix IVs with. You have to be very careful what you're mixing, because it's going straight into the veins. And then also, like, I don't know if it was in a hospital, um, there will have probably been like a blood work. First of all, they will do blood
yeah,
work, they will do
yeah.
urinalysis, they will want to find out what's in the blood, they want to find out what's in the urine, so that they can know if they need to counteract what's going on. You cannot just give medications without taking history, without doing physical assessments, without assessing and evaluating what is going on, taking your necessary questions. You come to my clinic and stuff like that. I'm asking you question. What happened? When did it happen? How are you feeling? What's going on? You're asking all these questions, and then you're trying to find out what is the probable diagnosis, what are the differential diagnoses,
All right,
and
let's
then
hear
from there you
from the
can now
doctor. We
decide.
have a doctor in the house. Let us hear from the doctor. Dr. Fredowski, where are you practicing medicine?
Daddy Freeze, good evening. I'm in Nigeria right now. I'm in Lagos.
Okay, awesome. So you're on ground. Tell us,
Yeah.
share your thoughts with us concerning
Okay.
this topic.
Okay, so first of all, let me say this. In Nigerian medical system, there is nothing like auxiliary nurse. Now, the history of auxiliary nurse started from doctors. Doctors messed up the system. And I'll tell you what happened. So some doctors actually can't pay the registered nurses. So what they do, they look for young ladies who never went to the nursing school or who never went to the university, and then they train them in the hospital.
Yep.
And these doctors certify them by themselves, which is not legal. And then these nurses over the years came out and started calling themselves nurses. And that word auxiliary nurse does not exist in Nigeria. Abroad, you can call them nursing assistant or whatever. Now, these auxiliary nurses have gotten to a point where they now assume the functions of the registered nurses. So there is nowhere in Nigeria where we have auxiliary nurse. It's either you are a nurse or you are not a nurse. It's either you are
Yeah.
licensed,
Yep.
and even when you have the licensed nurses, they know their limits.
Yep.
Auxiliary
Yep.
nurses don't know their limits. So first of all,
Yep.
let's not
Yep.
call them nurses. They are called
Yep.
quacks. But
Yep.
when you
Yeah.
try to say it
Yes.
outside, they come after
Yeah.
you. So
Yes.
medical doctors in Nigeria messed up the system. Some of the big medical directors, a lot of them, I know them, they know us, we know them. Big hospitals in this nation, you have most of the nurses are auxiliary nurses, and you can't even speak to them because they claim that they know the job much more than you. So even when you're trying to talk to them, they don't listen to you. So first of all, let's blame the doctors. They messed up the system. We are not talking about UK, we are not talking about America, we're talking about Nigeria. And most of these nurses, when you go outside, people regard them even much more than the registered nurses. So if you never went to the nursing school or you never went to the university to get trained, you must not touch a human being. And why is this important? Because the nurses who are trained, they know when to refer a patient to see the doctor. But the auxiliary, I'm emotional. I'm sorry, I'm being emotional because they've messed up the healthcare in Nigeria. Healthcare is
Not
crazy,
really.
and
Not really.
it's sad that we are talking about this when we lost someone. Next, we don't know who will be the next person. It might be your relation, it might be your family member or a friend. So in Nigeria, there is nothing like auxiliary nurse.
Yeah.
Now, when you say this, they come after you as if you are going against their profession. But let's call a spade a spade. Now I'm here and I'm not shying away that doctors are free. They messed up the system. The big directors, you will be shocked to know that some of the hospitals you go to, some of them, they have auxiliary nurses. So first of all, let's sanitize the system. And this whole conversation of are they auxiliary nurses or not, it doesn't exist. When you
No.
go abroad, then we can start talking about
Yeah.
care assistant or the rest. But it doesn't exist.
Yeah.
I beg. Let's
even
let
that
let
even that even that one, you have to go back to school to obtain that in order for you to practice as
it's
auxiliary
sad.
nurse,
It's
whatever
sad.
they
It's
call it.
painful. It's painful that we are having this conversation right now. And in pidgin English, now we mess up.
Language, 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 language.
It's really sad.
Sorry, that the phrase. Sorry, but we messed up. We messed up, and It's high time we all have a round table, everybody in the healthcare space, all
Yeah.
stakeholders. Now,
Yeah.
after having this conversation, now people will start thinking, why did he have to go there and say this? But it might be anybody tomorrow.
Yep.
You might be
Yeah.
traveling and you have an accident, and somebody needs to attend to you. And if you are not careful, one auxiliary nurse somewhere might claim that she knows what she needs to do and administer something to you. And if you are not careful, we are having this conversation again. So
God
please, there is
forbid.
nothing like auxiliary nurse in Nigeria. That origin came as, and that thing came as a result of the doctors trying to look
Yeah.
for cheap labor.
Yep. Yep.
Hmm.
Yep. Yep.
But
Very
even
good.
like just to add to what the doc is saying, right? To
Yeah.
there are some hospitals in the state here. Not to put any of them on the line, but when you do get a job, they have, that's why they try to make different levels. Like the sister was saying, right? They have regular CNAs, then they have the advanced CNA. You do go through the hospital system to be trained to do some of those things, but you can still not exceed that level. So I think part of what Doc is trying to say is all staff needs to know their limit and their practice boundaries.
Hmm.
When you don't know your practice boundaries, it causes problem. I don't give a rock about you not trying to pay somebody, but you do not use another life
Guys,
to put that on
be
the
very
line.
careful. Language.
That,
Let's
I
not
mean,
use any of those.
that the thing
Yeah.
will make I
Um.
say Rocco. I
Okay.
don't give a rock.
See, I want to say something. I'm sorry. I want to say something. The only reason why I'm actually even talking really is because I trained in Nigeria, and I do have. I was born and bred in Nigeria, to be honest with you, before I came here. So I trained in Nigeria in Lagos University Teaching Hospital, and I do understand the healthcare system. Even while I'm still here, I'm still in contact with the healthcare system in Nigeria. And Doc, you said everything correctly. If you go down into the history of auxiliary nurses, it was the doctors that trained them because they wanted cheap labor. And then, all of a sudden, because I think back in the day, back even before I was probably even born, but there was a lot of mistakes that was going on. And then what they did was that the Nigerian the Nigerian Nurses Association came together and decided that they were going to have nursing as a profession where you're going to get a degree. So it's either you get it as an associate degree through a hospital for 3 years, or you go into the university and get a degree. And then you are now certified, and you will go through the rotations according to the way the system or the program is. You have all your major courses. We have pharmacology, we have med surg, we have all of those courses that you have to do. Psychiatry, you go through everything. And then your clinical rotations, you have to go to all those rotations, from pediatrics to psychiatry. You go to all the rotations. Rotations were really, really difficult for me back in the day. And I know I have a lot of colleagues too that can say the same thing. It was tough. The exam was tough. The rotations were tough. It was not it wasn't a piece of cake. Your exams, your rotations, everything, even the final exams, it wasn't like a walk in the park. So when you're coming out and you're saying that you're a registered nurse, you can beat your chest and say, yes, I'm a registered nurse. What do you want me to do? I'll take care of it with confidence, because you know what you're doing, So we're trying to talk about it in the construct of Nigeria. Forget America or London or wherever, right? In Nigeria, what can be done so that no one will get into this problem where, we all have to, I think that what we have to do is that you can ask for qualifications. In America here, if someone wants to treat you, they can ask you, what are you treating me? Who are you? What are your qualifications? They have the right to ask. They have the right to ask, what medications are you giving me? You have to explain to them, I'm giving you this pill for this, and you have to explain all the pills you're giving to them. And they have a right to tell you, I want this pill, I don't want that pill. And they can ask you, what is your qualification before you touch me? And I feel like every Nigerian, if they can, should talk about, if someone is coming to treat you, you have a right to ask for their qualifications. You know, you have a right to do that, because I feel like your life is not something that you can buy in the market. It's very precious. So you can also be part of your own health. You can be part of, that's what we always teach people here. Be part of your own health, be part of your own care plan, be part of your own well-being. If you are part of your own well-being, you'll be more that you also you'll be very in tune to want to do stuff to make yourself feel better. You know, so
Yes.
if I am asking you, what is your qualifications? Can you do this stuff? Do you have anyone around you that is equally as good as you? You can get a second opinion. You know, it mustn't be that same person that you want to work with.
All
You can
right.
always get another opinion.
I want you to stay. Hold on. My darling sister from Liberia, please, can you leave so I can bring another nurse this time?
Yeah.
Thank you so much.
Yeah,
I
welcome,
really appreciate you.
Betty Phrase. Thank you.
The full fan, I'm gonna follow you right back. Hey, you didn't wait for me to follow you before you left. Anyway, there's another nurse that I'm going to bring. Oh my goodness, where is she? Hey, Nurse Zani. So nurse underscore Zani. Okay. So let me hear from her as we're rounding off on this particular topic.
Daddy Freeze, if I may add quickly, maybe I could calm down.
No.
Okay.
I added you earlier on, Nurse Zani now.
Yeah, I brought up this issue at first, that there's nothing like quacks. That there's nothing like auxiliary nurses, that quacks are quacks. So I think the other nurse who came in was trying to say no, that they are auxiliary nurses. I think the doctor has said it all. There's nothing like auxiliary nurses. A quack is a quack, because, like I said earlier on, there are rationales behind every steps in you give. For every procedure you do, there are rationales behind them. So most times, he said it, you find some doctors who don't want to pay nurses, and then they just train. They tell you come to school of nursing, and they just train you and give you a certificate, and they tell you you are automatically a nurse or an auxiliary nurse, and you start working with them. They learn practically from them without the appropriate knowledge, like the ethics, the conduct, the rationale. They have no idea about it. Like I said earlier on, ceftriaxone is given through 2 routes. I think that was the medication that they said was given to Mohbad. Ceftriaxone is given through 2 routes. Now, you can give it the right way, but through the wrong route. The doctor can still attest to it that if you give an IM ceftriaxone through your vein, it kills very fast.
Can I
Lidocaine.
Can I say something, please? Can I say something? Okay. In emergency situation, in emergency, nobody's discussing ceftriaxone. In emergency, you are concerned about the airway. You are concerned about if the patient is breathing. You are concerned about circulation. Now, auxiliary nurses don't have this knowledge. Ceftriaxone is not needed in emergency. In emergency, I'm coming. I know.
That's doctor. Doctor is your senior. Doctor.
No. I beg, please, let's not do that. Please, I beg.
Is doctor not senior of nurse? Let me ask.
We all have our feeds.
Everybody has their own,
We
all working together. We're all healthcare professionals. We all collaborate together to make sure that everyone is okay.
Sorry, I thought doctor was
he's not my senior.
I beg. Okay. So now there's a problem, Daddy Freeze. If you go to the hospital or you're managed by an auxiliary nurse, what you hear most time is malaria, typhoid. We're talking about emergency. In emergency, we have no business talking about ceftriaxone. If you are giving ceftriaxone, maybe you are preventing an infection. And if an infection is to occur, it might take you about 48 hours. So whatever happened, we don't even have the clear picture of what she really gave to Mohbad or something like that. Now, all we are trying to say here is we don't know who would be involved tomorrow. In emergency, we have what we call the golden hour, the airway, the breathing, circulation, and then you talk about medications, maybe medications to arrest bleeding, medications to help the heart and the rest. So auxiliary nursing does not exist. And I want to stay on that for certain reasons, because nurses have been disrespected. I'm not talking about doctors. Doctors, we have our own cases to discuss. But nurses have been disrespected by auxiliary nurses. And if care is not taken, if care is not taken, this will get to a point where we can address it. And that the freeze has given us the opportunity to address it right now. There is nothing. So if you're an auxiliary nurse and you're watching this live stream, I'm sorry that what I'm saying might hurt you. But if you want to be a nurse, either you go to the nursing school or you go to the university. Now, if you want to assist, if you want to assist in the hospital, you can assist, but please do not handle the human life. If you don't have the license to handle a human life, please don't touch it. Because somebody can be stable right now and immediately the person can become unstable. And then we don't know what to explain and how to explain it. But when you go back to the society, you hear people saying, this nurse no work past even the doctors. And you find out that the nurse is even a quack.
Yeah.
So please,
thank you so much for saying that. That is amazing. Thank you so much.
There is nothing like auxiliary nurse. It's either you are a nurse or you are a quack. I beg.
Now, let
I'm
me
sorry.
tell you guys something. Here's my own addition. Because my father is a doctor, and my younger sister is also a doctor. So we have 2 doctors in my family. Sometimes a doctor might be hesitant to give a medication because he wants to make sure your blood sugar is normal. He wants to make sure your BP is normal. He wants to make sure certain readings are taken into consideration before he administers a drug. But the nurse runs and gives you the drug, and it's guesswork. And your response is quick. You get results. That how you got that quick result is how you buy too.
Yeah.
But with a doctor, the likelihood that you will buy is very, very minimal. Because before a doctor administers something, he will have checked you properly. A nurse, it happened to one of my family members. The person slumped, and then the next thing we found out they were giving the person glucose. They now come saying the person is feeling better. Of course, you feel better when they pump sugar into your blood. How will you not feel better? But what if you are diabetic?
Daddy Freeze, can I share with you a story? So somebody complained of body pains, and then I had a conversation with this fellow, and he said, "I'm on paracetamol, I'm on diclofenac, and on ibuprofen together."
Hey!
And calm down. It's not over. And prednisolone. And I asked the person, "Can you please snap the medications and send to me?" So the person sent the PCM, sent the diclofenac, sent the ibuprofen and the prednisolone together. And I asked, "Who gave it to you?" Let's leave that. Now, when you take that medication, you feel okay. Your pain disappears immediately. And you say,
your liver disappears with it too.
And you say the nurse no work. These people know their job, but they are destroying that fellow. A doctor would not do that.
It's called polypharmacy. It's called polypharmacy.
I understand in some instances, after surgery, I've seen the combination of cocodamol and ibuprofen from a doctor. And I was a bit worried. It was one of my kids had surgery, and they prescribed cocodamol and ibuprofen because the pain threshold was very high. I started calling all my doctor friends. Everybody said, yeah, after surgery, Me said, the doctor said it, and this doctor was a surgeon. But I still did not trust. I was like, you don't combine anything with PCM. Is that you're on ibuprofen or you're, because cocodamol is PCM with codeine. So I was like, no. On my last day, by the time I called like 4 doctors, everybody and some. I called 4 doctors and 3 pharmacists. They all said it's okay, he's done. My mind now came down. But you will just go and combine
Now, there are certain medications. There are certain medication a doctor would not even allow a nurse to give. The doctor will sit down with the patient and will take that doctor 20 minutes to give. The doctor would not even allow the nurse to give certain medications.
Like
but the
what?
funny thing we have in this country, right? No. There's a reason I'm not. There's a reason now. There's a reason. Okay, let me tell you something. So these medications are to protect the heart. It will give you an idea to protect the heart. Now, if you go to the pharmacy, in Nigeria, everybody can access medication. Anybody can even buy anti-cancer medication. Anybody could just wake up. Anybody can just wake up, go to the pharmacy without a doctor's prescription. And then when complication arises and people start running to the hospital, and at that time is late. Most of the problems we are having are from the private hospitals, because the government hospitals, they do their checks, they screen and the rest. But in private hospitals, this whole stuff, we don't have it like that. So I want to appeal. I want to appeal again. If you are a quack, you are an auxiliary nurse, please go get trained. If you are not trained, do not handle. It's not easy to be a nurse. If you are not trained, do not handle the human life. And then to the doctors, let me use this opportunity to the medical directors training these auxiliary nurses. You guys are messing up the healthcare system. Some of them are so big that I can't talk to them. They are our orgas, very big orgas. When they come now, they don't bomb me well. I have to keep quiet. And some of them listen to this like this. So please, I beg you, sir, if you are training auxiliary nurses, you are messing up the healthcare system. Stop them, please. Thank you very much.
Thank you guys so much. God bless you. Thank you all the doctors. Sorry, the one doctor and all the nurses that came live. Thank you guys so much. I appreciate you. And we are part of sanitizing the society. We want a better society. We must be the society we demand. Take care and God bless. Justice for Mohbad means nobody else should buy in the hands of an auxiliary nurse. That is justice for Mohbad. And until this is sorted out properly, we will continue to wallow where we have been wallowing. Thank you all for popping my money guns. I'm going to come back later on in the night. We have so many things to talk about. Take care and God bless you.